Welcome to our shoulder arthroplasty enhanced recovery program. We're delighted that you're watching these videos, as we want to help you understand what will happen when you have your shoulder replacement, so that coming in to have the operation will feel easier and you'll find the period after your operation passes more smoothly. I am Alison Armstrong, and I am one of a team of consultant orthopaedic surgeons who specialise in upper limb surgery in Leicester. You will be under the care of myself or one of my colleagues who will have had discussions with you about your painful shoulder and that it will be best managed with a shoulder replacement. You will have your surgery under the same consultant-led team who saw you in outpatients. Having a shoulder replacement is a very effective method of getting rid of pain for your condition. However, it is major surgery, and we want to provide you with all the information you need to prepare for your operation and your recovery afterwards. There are 4 main types of shoulder replacement, and which one is best for you will depend on what precisely is wrong with your shoulder. Your surgeon will have considered your case and discussed this with you in clinic and made a plan. The shoulder joint consists of a ball, which is the head of the humerus, and a flat plate, which is called the glenoid. And in a shoulder replacement, all or parts of this joint are replaced by metal, ceramic or plastic. The 4 types of shoulder replacement that are in common use are, firstly, to put a cap over the head of the humerus, which is called a surface replacement hemiarthroplasty. But sometimes we need to take the head off, leaving a flat plate, and then we can put a head with a small stem called a short stem shoulder replacement, and that can be a hemiarthroplasty, half a shoulder replacement, or may have a glenoid attached. But sometimes to stabilise the prosthesis, we need to drop a stem down the body of the humerus. We can still put a head on the humerus, and we can still put a small covering on the glenoid to make a total shoulder replacement. Sometimes, however, in other conditions, we need to reverse the shoulder replacement. In other words, we make where the ball was into a socket, and the glenoid, which has a plate on it, then has a cap put on the plate, and then that becomes the ball, and we have a ball and socket reversed, called a reverse shoulder arthroplasty. There will now be some videos from the nursing, occupational therapy and physio teams who have important things to say to you to help you prepare for your operation and get better more easily. You may have some questions which we have not answered in these videos. Please write them down and keep them safe. To help you with this, you will be rung by a member of the team just after you've been asked to watch the videos, and they will answer your questions or direct your question to the best member of staff to help you. Thank you.
Hello, my name is Donna and I'm here to tell you what to expect when you come into hospital. You would have received a letter from the hospital telling you what date of your operation, which ward or department you need to go to and what time you need to arrive by. Please bring all your medications in that your GP has prescribed for you. A family friend or a member of the family can bring you into hospital, but unfortunately they cannot stay with you. When you arrive, you'll be welcomed by a member of staff. They will take your temperature and ask you a series of questions before showing you where your bed space is. You will then be seen by a nurse looking after you for the day. That is your named nurse. You will also be seen by the consultant, the junior doctor and the anaesthetist. They will confirm all your details that you gave in the pre-assessment clinic. If any of your details of your medication, your lifestyle or your circumstances have changed, now's the time to tell them. The consultant will go through the details of your surgery, answer any of your questions and confirm that you wish to go ahead with the surgery, and then they will sign the consent form with you. It is very important that you have followed the instructions given to you in pre-assessment regarding fasting, medications, diet and lifestyle. Throughout your stay, you'll be asked lots of questions by several different people on whether you're allergic to any medications. This is routine. You'll be given an identity bracelet, one for your wrist and one for your ankle. You will need to wear this at all times and it will be checked at each stage of your treatment. This is to ensure that we have the correct patient and that you are not given anything that you're allergic to. You'll be asked to get undressed and change into a hospital gown, like one of these. And when it is time, a member of staff will take you down to the theatre reception area. For many operations, a needle connected to a drip will be put into the back of your hand. This allows fluid and medication to be given to you while you're under anaesthetic. After your surgery, you'll be moved into the recovery room where you'll be told how your operation went. You'll then be taken back to the ward. As you come round from your general anaesthetic, you may feel a little bit groggy and a little bit hazy. The nurse may give you some oxygen, and that will either be given to you through some tubes that sit in your nostrils like that, or through a mask. This is to help you make you feel better. It is common to feel sick or even be sick after your operation. The nurse may offer you some medications to help with this, and you may have a sore throat and a dry mouth. Again, this is all common. The nurse will also take your blood pressure and your temperature regularly. This will be done by an automatic cuff. It goes around your arm and it can squeeze quite tightly. And a thermometer that goes inside your ear, and that takes your temperature. When you come back from your surgery, you are quite likely to have had a local anaesthetic block into the whole of your arm. This will help you with pain relief for about 8 to 24 hours. It is really important that you take painkillers before the block wears off, and you continue to take them regularly from the nurse. She will give them to you about every few hours. In the days following your surgery, you will have some pain. This will be the pain from your operation. This will be a different sort of pain from your arthritis, for which you will require painkillers until it settles, and whilst you're doing your exercises. Once the health team looking after you has decided that you no longer need to be in hospital, you will be discharged. You will be given pills for up to 10 to 14 days to take home with you. It will be explained to you how to take them and how often. You'll be given letters to take home with you, one for yourself and one to give to the practice nurse. You will need to make an appointment with the practice nurse at your GP surgery. This is so you can have your wound checked and any stitches taken out. You'll also be given advice on how to care for your wound. You'll need to keep it clean and dry. You are not to get it wet. So no showers for up to 2 weeks or until you have been to see your practice nurse. You'll be given spare dressings to take home with you. This is in case it needs changing before you see the nurse. Make sure you wash your hands before and after, and you may need someone to help you. So there's the dressing. It just needs pulling apart. This is not waterproof. You may notice some bruising. This is normal, but if you notice any redness around your wound or fluid or any increase in pain in the area, please contact your GP. You will have an outpatient's appointment. It's usually between 6 to 8 weeks after your surgery. This is to check your progress. This appointment will be posted to you. So getting home, you will need to ask someone to pick you up or take you home in a taxi. You will not be able to drive yourself. It is advised that an adult stays with you for at least 24 hours after having a general anaesthetic. So once you are home, in the days after your operation, don't be surprised if you feel very tired. This is normal. You should only do as much as you feel able to, but it is important to try and move as soon as possible and follow your doctor's advice on getting active again. This will help your blood flow, your wounds to heal, and to build up strength in your muscles. Generally, try and get back to your regular routine as soon as possible. The sooner you start to move around, the better. Lying in bed for far too long can cause some of your blood to pool in your legs. This puts you at risk of blood clots. You will be given a leaflet on preventing blood clots. If possible, doing some leg exercises. These may be as simple as flexing your knees or ankles and rotating your feet. You may be given special support stockings to wear after your surgery to help you with blood circulation. Your nurse or doctor will explain how you use these. And some people are given an injection to thin the blood. Again, this helps reduce blood clots. Some people are given an injection to thin the blood slightly to help reduce the risk of clots. And finally, so that you're prepared for coming into hospital, make yourself a list of things that you need to bring with you and any questions you want to ask.
Hello, my name is Cheryl. I'm from the Occupational Therapy team. You'll be seen by a member of the Occupational Therapy team once you return to the ward, and they will ask you some questions to see whether you need more occupational therapy assessments before you go home. If you need further assessments, this will help to see if any equipment or a package of care is needed. Before this operation, we ask that you think about everyday activities you may find more difficult. You will need to think about making changes to your daily routine to help you be more independent once you are home whilst you are recovering. We would advise that you think about arranging for someone to help with domestic tasks such as cleaning, laundry and shopping, as social services do not help with these activities. If no one can help with the food shopping, laundry or cleaning after your surgery, your occupational therapist can signpost you to agencies that can offer these services, but it is likely there will be a charge. Here is some advice of what you can do before coming in for your operation.
Preparing your home environment. Ensure you have stocked up on everyday food essentials. You can always freeze bread and milk for when you get home. Make sure you have everyday items in easy reach to prevent overstretching or reaching. You may struggle to carry items from one room to another. It may be worth seeing if you can move a chair temporarily into the kitchen so you can prepare and eat your meals. After your operation, think about meals that are easy to prepare. Ready meals or already prepared frozen meals may be easier. Avoid heavy items such as overfilled saucepans or kettles. Only fill with the water needed. You may want to consider having a medicine box after your operation to make taking medication easier. Think about who can look after any pets, children or relatives if you are their main carer. Ensure you have removed any clutter to allow you to move easily around the house and there are no trip hazards. Putting your clothes on over the sling. Taking your t-shirt off from over your sling. Putting your t-shirt on. Taking your t-shirt off.
You will be required to wear a sling for a few weeks after your operation. This is to allow a period of rest for your shoulder. This can be worn over or underneath your clothes, whatever you're more comfortable with. You will need to remove the sling for exercises. To put the sling on and off, if you rest the sling on the table in front of you, you place your elbow into the sling. Pop the strap over your head, and then you can pop the strap through the hole, pull this through and adjust to the height that you're comfortable with. To remove the sling for your exercises, you may want to rest your arm on the table, undo the strap, you can take that off and release your arm for exercise. From day one, you will be encouraged to do the following exercises. We strongly encourage you to start these exercises before your operation, ideally from now. This will help maintain your movement and strength before the operation, encourage muscle memory and help your recovery after the operation. Whilst in your sling, you will need to regularly perform finger, hand and elbow exercises to prevent stiffness. You can do these by moving the hand backwards and forwards whilst in the sling, opening and closing the hand and releasing the elbow to do some straightening and bending. Doing some table slides really helps to support the shoulder and get some gentle movement. So if you sit with your chair slightly away from the table, rest your forearms on the table and lean your body forwards and backwards as far as you're comfortable to go, and this will help move the shoulder whilst resting the muscles in the shoulder. You can also do some pendular exercises. For these, if you stand next to a table or the kitchen surface and lean through on your unoperated arm and let the operated arm hang down. For this, you can just let gravity swing backwards and forwards, side to side, and in a clockwise and anti-clockwise direction, going in as big a arc as you're comfortable to. We would also encourage you to do some active assisted exercises. So if you support with your opposite hand and do some turning out, back towards the stomach, and also just pushing the arm backwards and back to neutral. Getting into good habits with exercise before your operation is really good preparation. Ideally do these exercises daily between now and the day of your operation. During the early weeks, you will need to do these exercises around 3 times a day, spending around 10 minutes on each session, exercising gently within your pain limits and increasing as you're able to. We expect some pain when doing your exercises, but don't force the movement in the early stages. Your physiotherapist will guide you when to remove your sling and progress. It is not common to recover full range of movement after this surgery, but the more you exercise, the more you are likely to recover. Full recovery can take over 12 months. Expected milestones. Driving is around 6 weeks, but you need to be able to control the car safely and drive with due care and attention, so this can be variable. For sport, swimming breaststroke may be as early as 6 weeks, but depends on your recovery. Front crawl and other strokes may be around 12 weeks. Golf may be around 12 weeks. Light lifting around 6 weeks. So you may, if you have a desk job or light work, be able to return at 6 weeks. If you have a manual job, this will be guided by your surgeon. Shoulder replacements are not designed for heavy lifting regularly.
You can ask as many questions as you would like, and all your questions are answered, and don't be afraid to ask any, because everybody's there to tell you, the answers. They won't bite you. The consultants and the doctors, they're all human beings, so they're very nice, albeit they're very clever. And very caring and very good at explaining everything to you. So that's really the key point, that you must ask when you go and get more knowledge of what's going to happen. It's very important that you understand as well, because it's a big thing to go ahead with, in my opinion. An operation day is made as easy as possible. All the staff are angels in my eyes, very caring, patient, and someone is always with you. You're never left alone, that's the main thing. And as soon as you're back on the ward, somebody's there with you, taking care of you. And you just have to put yourself in their hands, because there's nothing you can do then. When you're in the midst of it, you're just waiting to be cared for. And they make sure everything is okay through day and night. And as soon as I got back on the ward, my consultant and the registrar came to see me. Well, soon after. I mean, I don't know how long I'd been on the ward, to be honest, before they came. But that evening they came to tell me that everything had gone well, and that, you know, they was pleased and all okay, went well. But I thought that was such a lovely thought both times, because they both had, everybody in there had a hard day, but they found the time to come and say hi to you, and we were there for you. But getting prepared to go in is another big thing, because it is a big thing. You've got to think ahead, which a lot of people perhaps don't do, to get all your clothes organised on bottom rails, because we can't lift high, all your open front blouses, dresses, tops, cardigans. Some you can't wear that you to pull over your head, so you've got to make sure you can have just loose things that you can put on, all on bottom rails, so you've not got to lean up, leave high, reach high. And shopping wise, fill your freezer with as much as you can, and all your heavy shopping, buy all your heavy stuff in, so you've not got to do it, and be prepared really. The one thing I didn't expect the first time I went through it was how long it would take to actually get better. The actual physio, I didn't realise it would take so long. So obviously the second time I am more prepared. But the first time was quite a shock when I knew it took months, over a year in fact, 18 months. But that's the most important thing in my thoughts, that if I hadn't have done my physio, I wouldn't have been able to use my arm like I use it now. Because that's very, very, very important. You can quite easily say you don't want to do it, and it does hurt, it is painful, and it does take some time up, and you have to make yourself do it, because sometimes you're very tired. But if you don't do it, you don't get there in the end. That's and you wouldn't get it moving so early, and a lot of people I've met since, they can't use their arms, and I think, well, why? But I can't be doing all the physio, but it needs to be done, because otherwise you don't get it back. And it took me a long time, but I did get there.